Hi everyone, I'm Neil Anthony Cango, a fourth-year psychology student of Riverside College. So today I will be discussing about complex behavior, which has four subtopics, which is learning and memory, intelligence and cognitive functioning, psychological disorders, sleep and consciousness. And I will show you the PowerPoint presentation. Okay, so the first subtopic that I will be discussing is about psychological disorders. And the article that I have chosen is the coronavirus pandemic's impact on mental health. A pandemic is not just a medical phenomenon, it affects individuals and society and causes disruption, anxiety, stress, stigma, and xenophobia. Resulted in the enforcement of regional lockdowns to stem the further spread of the disease, isolation, social distancing, and closure of educational institutes. Workplaces and entertainment venues consign people to stay in their homes to help break the chain of transmission. Restrictive measures have affected the social and mental health of individuals. Government must take the necessary measures to provide mental health support as prescribed by the experts. The psychological state of an individual that contributes toward the community health varies from person to person and depends on his background and professional and social standings. Quarantine and self-isolation can most likely cause a negative impact on one's mental health. Separation from loved ones, loss of freedom, boredom, and uncertainty can cause a deterioration in an individual's mental health status. And children and teens at risk. Anxiety, distress, social isolation, and an abusive environment that can have short or long-term effects on their mental health. Common changes: excessive crying and annoying behavior, increased sadness, depression, or worry, difficulties with concentration and attention, changes in or avoiding activities that they enjoyed in the past, unexpected headaches and pain throughout their bodies, changes in eating habits. What parents should do: remain calm, deal with the situation wisely, and answer all of the child's questions to the best of their abilities. Take some time to talk to their children about the COVID-19 outbreak and share some positive feedbacks and information. Reassure that it is safe at home and encourage to engage in some healthy activities including indoor sports and some physical and mental exercises. Develop home schedule that can help their children to keep up with their studies. Show less stress or anxiety at their home as children perceive and feel negative energy from their parents. Elders and people with disabilities at risk. More prone, weaker immune system, or other underlying health condition. Physical isolation at home among family members can put the elderly and disabled person at serious mental health risk, cause anxiety, distress, and induce a traumatic situation, especially elder or nursing home system or other underlying health conditions. Elderly behavior: irritating and shouting behavior, change in their sleeping and eating habits, emotional outbursts. Family members should regularly check on older people living within their homes and at nursing facilities. Health workers at risk: doctors, nurses, and paramedics working as a frontline force. Catching a disease, long working hours, unavailability of protective gear and supplies, patient load, unavailability of effective COVID-19 medication. Death of their colleagues after exposure to COVID-19. Social distancing and isolation from their families and friends. Health workers should take short breaks between their working hours and deal with the situation calmly and in a relaxed manner. Stigmatization. People recently released from quarantine can experience stigmatization and develop a mix of emotions. Recently recovered may have to exercise social distancing from their family members, friends, and relatives to ensure their family's safety. Infected individuals may develop sadness, anger, or frustration because friends or loved ones may have unfounded fears of contracting the disease from contact with them. Understanding the effects of the COVID-19 outbreak on the mental health of various populations are as important as understanding its clinical features, transmission patterns, and management. Spending time with family members, including children and elderly people, involvement in differently healthy exercises and sports activities, Following a scheduled routine and taking a break from traditional and social media can all help to overcome mental health issues. Public awareness campaigns focusing on the maintenance of mental health in the prevailing situation are urgently needed. The second subtopic that I will be discussing is about learning and memory. And the article that I have chosen is the techniques to enhance learning and memory. Medical conditions causes impaired memory. Multiple sclerosis, traumatic injury due to accident, stroke, non-neurological causes, diabetes, cardiac failure, major depression. Research of Kessler Foundation focused on memory rehabilitation. Memory three stages. Encoding. Main focus. Vast majority of memory failure occur. Consolidation, retrieval. Techniques to enhance learning and memory. Imagery. Process by which we attach a mental image or picture to a verbal idea, forcing your brain to encode information. Image of house is being processed or remembered by your spatial memory system. Increasing brain activity and helping your brain remember. Combined unrelated material into one image. 5 tasks, butter, coffee, 9 a.m. meeting, call mother, buy apple, network password to blossoms. Remembering things to do for the day into vision. Context comes before or follows a word. Create a mini story. True power of context comes when combined with imagery. These techniques are being used to patients with traumatic brain injury and multiple sclerosis. 10 sessions, 5 sessions per week for 2 weeks. They find a significant improvement on their memory abilities. The patient did better after treatment. Patients are reporting that their memories in daily life are better. They are able to apply the technique on their daily life. They also saw more activity on the brain through MRI. So the third subtopic that I have chosen is sleep and consciousness, which the article is Can COVID Cause Insomnia? Among the main pandemic era health concerns is insomnia, or the ability to fall and or stay asleep. The effects on sleep have been so significant that within the first weeks of the shutdown in 2020, prescriptions for sleep medications in the US increased by 14.8%. While it's true that some COVID survivors with long-term symptoms experience insomnia, the Centers for Disease Control and Prevention does not list this sleep disorder as a common COVID-19 symptom. Rather, many of the new cases of insomnia are caused by pandemic-related stress, dubbed coronasomnia. Sleepless nights can also be caused by a total disruption of daily routines, monotony in the day, or complete lack of daily routine. One sleepless night does not mean you now have insomnia. With a few simple changes to your daily habits, you can get your sleep back on track. The past year has left you tossing and turning at bedtime. Here are a few tips to help you catch some Z's. Establish a routine and stick to it. This means waking up and going to bed at the same time every day and creating a relaxing bedtime routine. Dim the lights, have a warm cup of caffeine, free tea, or read a book. Anything that helps you wind down. Get moving during the day. Studies have shown that regular exercises, specifically moderate aerobic exercise like walking, can help people with insomnia fall asleep faster and stay asleep longer. Turn off your devices. Blue light from cell phones, tablets, and computers can suppress the secretion of melatonin, the hormone that makes you sleepy. Avoid this by powering off at least an hour before bed. Don't use your bedroom as an office. Your body should associate this room with sleep, not work. If you can't avoid a bedroom workspace, at the very least, don't work in bed. If sleep evades you, get out of bed. Getting anxious about sleep can actually perpetuate the problem. If you don't fall asleep after about 30 minutes, get out of bed and engage in a relaxing activity or meditation. Talk to your doctor if your insomnia has persisted for a few weeks. Your doctor can help find the right solution for you. So the last subtopic that I will be discussing is intelligence and cognitive functioning. And the article is Understanding ADHD. Brave Mom Tells Her Story. So, attention deficit hyperactivity disorder or ADHD, most common mental health disorder among children. Age inappropriate hyperactivity, impulsivity, poor attention span, cause impairments in academic and social functioning, self-esteem, very poor academic performance, and serious behavioral problems. Hyperactivity tends to decrease with age. So the teacher described the the one with ADHD, as hyper, uneasy, distracted, overwhelmed. Attention deficit hyperactivity disorder is a neurodevelopmental disorder, and the symptoms are usually divided into two categories: inattention or the inability to focus, hyperactivity, impulsivity, or the inability to stay still or control behavior. Most children experience symptoms of both. This is also known as ADHD, combined type. Acceptance is crucial. After learning of her son's diagnosis, she took a special education module, attended several seminars and trainings activities for her to better understand her son, and eventually she got involved in the ADHD Society in the Philippines. Values and discipline. The outside world will still be full of things that can tempt him: alcohol, drugs, bad company, abusive relationship, debt. Children and teenagers with ADHD can easily fall prey to this because of poor self-regulatory skills. They regularly attend Mass together as a family and also enroll their children in a Christian community school. They are very active in their church activities. Gab in fact lead a group where they meet on a regular basis. More mother reassessed and realized a lot of things. She learned to let go of her entitlement as a mother. She realized that pride and perfectionism keeps on putting a great weight on me. She chose to be a flexible person by listening with the intent to understand and not anymore listening with the intent to reply as I used to. Gab is a 22-year-old, fourth year college, BS Education major in MAPE de La Salle Araneta University. Mother of Gab's advocacy. Mami Josephine laments that the ADHD awareness advocacy has not yet reached schools and universities and even the barangays of the 17 local government units in Metro Manila. So, I already discussed the 4 subtopics and I hope you learned something today. Thank you.